What's your take on this bit of breaking news? Do you think it will drastically change the rates of vaccination, or is that really defined by other factors at this stage?
Yeah, I don't think it's really going to change the equation for a lot of employers. Previously, the EEOC had recommended or had issued guidance saying that businesses could require vaccination. This seems to be a more binding recommendation. But I don't think it's going to change the equation in terms of businesses thinking about requiring vaccination. A lot of businesses seem reluctant to do that right now. I think for right now, large businesses are surveying their employees and seeing how many are actually getting vaccinated. And if they have a sufficiently high level of vaccination among their employees, I think that they're going to be reluctant to mandate vaccination. You could see a situation where a lot of smaller employers start to do that, particularly employers who have employees that are consumer facing, so restaurants, people who go into homes and provide services. I can see a situation where a lot of small private businesses require vaccination among their employees, but not large businesses, based on my conversations with CEOs for now.
Wanted to ask what your view was on whether masks should still be required on planes. We've seen a pickup in a number of cases of unrest on planes, and to some extent it's quite understandable when people have seen the CDC guidance that masks aren't necessary anymore for people who have been vaccinated, and then they get on a plane and they're told they have to wear one throughout no matter what.
Yeah, look, I think it's going to get increasingly difficult as prevalence declines. When you look across the country right now, we're heading towards 5 cases per 100,000 people per day. It's going to get lower than that as we get into July and August. So I think you could see a situation where those restrictions get lifted and it's just optional. And there will be people who prefer to wear a mask when they're on mass transit, when they're on an airplane or other kinds of mass transit, but it's not going to be required. I think as we head into the summer, I would suspect that you're going to see the federal guidance on the requirement for masks on mass transit, on airplanes get lifted, just because prevalence has declined to a level where the risk just isn't sufficient to justify the requirement anymore.
So you've predicted quite accurately, Dr. Gottlieb, that we're going to be in good shape in the summer and as it gets warmer, but have also warned about the fall and winter and seeing a rise in cases. And I'm wondering why you're predicting that, given some of the studies out this week showing that people who have been affected with COVID-19 have even longer lasting immunity than thought. And that, along with the vaccinations, could mean they might never need boosters. So why do you predict this is coming back?
I think that that's right. The vaccines are proving to be more effective than we first anticipated. It seems that the immunity you get from prior infections is more durable than we first anticipated. I don't think this is going to be an issue for the fall. If you look back at last year, the number of cases around the United States actually hit their low point on September 14th. So cases didn't start to pick up until we got into November. That's going to probably be even later this year because of all the prior immunity in the population. So I don't think we're really going to have an issue in terms of rising coronavirus levels until we get into December, maybe January. This is going to be a late winter pathogen. But I do think that there's pockets around the country where vaccination rates are low, where there are people who haven't been infected. So you're going to see outbreaks. I don't think we're going to see anything on the scale of what we've seen in the past. We're not going to see a national epidemic, but we will see isolated outbreaks. And I think the public health steps that we're going to take are going to be reactive, not proactive. So we're not going to shut things down in anticipation of rising coronavirus levels. What we're likely to do is implement some public health measures when we have outbreaks in certain cities or in certain school districts or in certain schools. So it's going to be much more reactive than it's been in the past. The bigger risk probably this winter, heading into the winter, is going to be from flu. We missed a whole year in terms of getting immunity into the population from flu. And if we have a mismatch this year between the vaccine and the prevalent strain of flu that's circulating, we could have a difficult circumstance with influenza. And the co-mingling of influenza with coronavirus could be the more difficult circumstance.
Shepard Smith here. Thanks for watching CNBC on YouTube.